Gauteng Health is visiting 3 hospitals affected by water shortages. The Rahima, Moosa and Helen hospitals, as well as Pholosong in Ekurhuleni, have been dry for over a week now, and families of patients have been taking water and food to their loved ones. So our reporter Heidi Giokos joins us now with the very latest regarding how, the lack of water is impacting certain parts of this area, but also if water now has been restored. Heidi, good morning to you, colleague. I mean, when you think of hospitals, you think about, healthcare workers that need water to sustain good hygiene in conducting their work alongside patients. But also when you hear that family members are bringing in water and bottled water for their loved ones, then one begs the question if water has been restored in these hospitals. What do you have for us? Good morning.
Yes, good morning, Tumelo. I think it's rather disappointing. We were supposed to have an interview with the MD of Joburg Water at 9 o'clock this morning, and I want to read you the message that I received at 8:01 to say that the interview will no longer be happening. The message says we have to reschedule the interview. There's a Rand Water meeting that's at 8. There was a pile failure at the Zekerbosch pump station overnight, which has impacted our reservoirs. Post the meeting, we'll propose a new time and date, and Rand Water will be issuing out a statement about these developments at their pump station. I want to speak about the fact that we have been trying for possibly over a week to get Joburg Water on, to explain exactly what's going on. A statement that has been released on their Twitter feed says that about 8 reservoirs are critically low and about 2 of them are completely empty. They are attributing this to the fact that there is a very high demand. We've moved into a warmer season. People are probably using a lot more water. But at the end of the day, you need Joburg Water to explain exactly what's going on. Last week, Friday, I was in the south of Johannesburg where residents there did not have water for 18 days. We are currently in the Rampart Ridge area, and we are joined by the councillor here, Devon, who we do understand, thanks for your time, Devon, we do understand that this area also has been struggling immensely with no water supply. What is the latest?
Thank you, Heidi. Just like as the media struggles to get answers from Joburg Water, the councillors also struggle from Joburg Water. And I'm glad that we're all applying the pressure because we're all wanting answers. Because every time Joburg Water releases a statement, we just ask more questions because they actually produce more questions than actually give us answers. In this area, the residents have been suffering. There's been also a lot of vandalism, but there's also been some poor workmanship that's been happening in this area, and so there's bursts and leaks happening all over the area. And when Joburg Water tells us that they're blaming the consumers that are using high consumption, we like saying, but how can I tell my residents that please reduce your consumption when they're all telling me that there's leaks in this street, and it's going on for 4 months, and still Joburg Water hasn't responded to it.
I want to speak about those leaks and bursts because it's a huge issue, and it seems as though Joburg Water takes some time to actually respond to all of this. That's obviously contributing to the loss of water that we are seeing.
Yeah, look, I understand when Joburg Water sometimes says to me there is lack of resources, and especially when one depot is serving from Soweto all the way to Kaya Sand, you can already imagine the vast area. And then but the problem is when the communication, I rather prefer communications constantly. We're not going to be able to attend to it this week. Then I know I can escalate it to the MMC to say, please, can you try and find more resources because Joburg Water has informed me that they can't attend to this leak for this week. So if I get more proper communication, then I can intervene more by knowing where I can put the pressure on so I can get the intervention needed.
Sure. Let's quickly speak about the water struggles in this particular area. I mean, it doesn't help that Joburg Water doesn't communicate effectively, but there are hospitals in this area, there are old age homes, there's a lot happening in this area. There's obviously a huge impact with no water.
Yeah, so I remember one time the communications stakeholder said that, Joburg hospitals, it should be their responsibility to make sure they've really got their own private JoJo tanks in place for emergencies and stuff, and shouldn't rely on Joburg Water. But the problem is Joburg Water is mandated to provide water, so it's always this, slightly shifting the blame. Joburg Water needs to have a strategic plan to ensure that they've got all their bases covered, especially for the people that really need the water.
Certainly. Okay, thank you so much for your time. We do appreciate it. And I just want to emphasize on something that Councillor Devon Steenkamp just touched on, Tumelo, that you get messages like, perhaps have a JoJo tank or find alternative ways of getting water. But it's Joburg Water's mandate and responsibility to supply residents with water, or businesses or hospitals or old age homes or whatever it might be. So getting messages such as use water sparingly or find alternative sources of water. It's like the same thing with electricity. It's their mandate to supply us with water. So it's the very same thing that's now happening with hospitals. Hospitals have now had to find different ways of getting water because they can't rely on Joburg Water. And this is why we needed Joburg Water to explain what the situation is. Maybe there's a bigger problem that we just don't understand as residents of the city of Johannesburg that needs to be explained to us. If people are using water excessively, those areas need to be targeted, need to be addressed, businesses need to be addressed, whatever the case might be. But I think what's even more alarming is that you might not have water for a couple of days and then your water bill is still exorbitant, but you haven't had water, for example, 18 days like those residents in the south of Johannesburg. So the problem is big and we definitely need Joburg Water to explain this. I mean, the councillor just said that the media is also struggling, but councillors and residents are also struggling to get proper communication. It's one thing to send a statement out and say our reservoirs are critically low, but it's another thing to say, okay, but this is what we're doing to sort this out. So it's a major challenge, and we will be moving to a number of hospitals throughout the morning and the day at Tumelo to get an understanding of how hospitals are coping, given that water is life and we just don't have it at this particular point.
And that insight quite critical to get an understanding of how healthcare workers are coping at this time, how the interruptions have rather impacted on their work. They work with hygiene, 100% of the time. So if they have to almost get creative with water and as far as hygiene is concerned, when dealing with patients, you can imagine how much of an inconvenience, but also a very difficult working environment that can be. So it will be very, very insightful to see, Heidi, as you go to these hospitals, to see whether or not there are, alternative water tankers provided for them, just so that they can at least cope under the amount of pressure, understandably, that they're currently working under. So we'll leave it to you, colleague, and we'll be sure to come back to you as soon as you have rather placed yourself in one of the hospitals. But again, as Heidi has mentioned before, she was meant to speak to the MD, one of the executives there, regarding why water, there's a shortage of it, why this stance around, interruptions even affecting the likes of hospitals, what's been done, but unfortunately that conversation being cancelled, saying that it will be moved, they will continue to issue more communication, and we'll update you, of course, on the go as we receive it.